How did we get here?
That's the question, Jaylen. And today, we're going to answer it. Because recently, Jaylen Brown hasn't just been known for his game. He's been known for Staingate, accidentally staining other players' jerseys with hair fibers. But has he ever had a hair transplant? As a double board certified hair surgeon, I'm going to take a look at Jaylen Brown's hair loss journey. Let's try to figure out what might actually be going on. Have you heard of Staingate? During multiple games, players noticed dark streaks on their jerseys after guarding Jaylen. It turned out to be from hair fibers. This is from keratin powder that makes thinning areas look more dense. And Jaylen didn't hide it. He went live on Twitch and even called LeBron James for advice.
Bron, little bro, call me back. We got some real shit to talk about. I need to know turkey or no turkey. And I ain't talking about no cheese sandwich. He gonna call me back.
You forgot about it?
Rod Dog calling you back. He gonna call me back.
But that moment actually opens up a bigger conversation about how common hair loss is, even amongst top athletes, and how early signs of hair loss can go unnoticed. Let's start from the beginning. In 2014, at the age of 18, we see strong hair fullness and well-proportioned horizontal thirds, and a clean but not perfectly straight hairline. That's important because natural hairlines are almost never ruler straight. In 2015, at the age of 19, we can see how Jaylen's anterior temporal peak lines up just slightly lateral to the tail of his eyebrows. And that's typically ideal balance and positioning of the temporal peak. When surgeons bring the temporal peak too far in, it can sometimes look like the forehead is just too small. And that's something we saw with Jamie Foxx's earlier look. We covered that in one of my previous videos. And notice how the temporal density is usually lighter than the rest of the hairline. This is why when I perform hair transplant surgery to restore the temporal area, I'm almost always using single hair grafts exclusively at the temples to create that more natural, finer look in that location. It's that level of detail that typically creates an undetectable surgical outcome. In 2016, at the age of 20, we see some slight asymmetry now appearing at the hairline. The right side of the hairline sits slightly higher than the left side. This is totally normal, and every face has asymmetry, and this is the type of pattern that we often see at the hairline, that the right side recedes slightly more than the left. In 2017 and 2018, I see no major change. This is sometimes what I refer to as the plateau phase, often the last calm before some subtle thinning sets in. And for many men, that's the window for when prevention really counts. And we'll talk about proper hair loss prevention in just a minute. By 2019, at the age of 23, we finally see some slight frontotemporal recession. It's subtle, but this is exactly the time when medical therapy works best. Once miniaturization progresses, it becomes much more difficult to reverse this process. That's where medical therapy, like topical or oral finasteride or dutasteride, can prevent further hair loss. If you're losing hair and you're looking to obtain one of these medications to stop the progression of hair loss, you should talk to a trusted hair doctor, or you can visit feelconfident.com, fill out a questionnaire, and see if you qualify to have one of these medications directly delivered to your home. In 2020, at the age of 24, we see that Jaylen now sports a shorter hairstyle, and this makes the hair thinning appear more noticeable, but he's still able to keep those sharp lineups. Those precision cuts can hide early recession quite well. In 2021, at the age of 25, we're now starting to see a little bit more irregularity at the hairline. The hairline is still in the same general position, but it's just less crisp now. This often signals follicular miniaturization. The hair is getting thinner, but it's not gone yet. Think of it as your warning light blinking before the engine fails. In 2022, at the age of 26, Jaylen's hairline is now sitting higher. And to keep it looking straight, he's now cutting it even tighter. But tighter fades plus braids and twists can increase traction, and over time that can lead to traction alopecia, which is when you're causing inflammation on the root of the follicle that can lead to inflammation and subsequently hair loss for some individuals. So here we likely have a double hit. The hair loss we're seeing in Jaylen's case is partly due to androgenetic hair loss, which is the most common form of hair loss in men, and possibly traction alopecia, which is coming from his hairstyle. In 2023, at the age of 27, the same hair loss pattern continues. Even though the hairline looks well defined, the density behind it is getting lighter. It's like outlining a house when the structure inside slowly weakens. In 2024, at the age of 28, we see continued hair thinning along the hairline as well as other portions of the scalp, the frontal scalp, and parts of the mid-scalp and crown. His barbers and stylists are probably working overtime to give him the illusion of the most possible density. And in 2025, at the age of 29, this is where hair fibers are now coming into play. And as there's contact on the court, some of these fibers are transferring over to the jerseys of others, the so-called Staingate phenomenon. And you can see that clear outline of the fiber right at the temples, and that's where the powder is reinforcing fading edges. It's a smart cosmetic trick, but maybe not ideal for the NBA court. And yes, he even called LeBron James about it during his live stream. And we do have a video on LeBron James if you want to hear my thoughts about his hair. So what can Jaylen Brown do now? Well, the number one thing is going to be prevention, and that starts with reducing traction on his hair. He can also consider medical therapy like finasteride and minoxidil. Most of our patients take those orally to help prevent further hair loss. And one great place to get them, as I mentioned previously, is feelconfident.com. Jaylen can continue to do what he's been doing, which is style camouflage. And that's using dye or fibers to keep his hair looking as dense as it can look. He can maybe go with a lighter application of the fibers so it's less likely to transfer over onto other objects. Another option is that Jaylen can go bald. That's a strong statement, but it's something that works for many athletes and for myself, even though I have an autoimmune type of hair loss called alopecia areata, but I've learned to accept the bald look. And that's something that many people end up doing even if they have the more common androgenetic type of hair loss. Jaylen can also consider getting a hairpiece, though it might be hard to maintain it given all the sweat and friction and daily practice that he has to undergo for his work. And of course, there's the possibility of a hair transplant. And that's something that Jaylen was hinting at during his live stream. It's important to recognize that Afro-textured hair requires a highly experienced hair surgeon who's comfortable with that degree of curl. Because remember, while the hair is of course curly on the outside, it also has a curl that dives deep into the skin. So when hair is being harvested with, let's say, FUE technique, it's important to follow that curvature to not get a high degree of transected grafts. And even the way that the hair is implanted needs to be done with a special technique so that you follow that curvature back into the skin and so that you have a high degree of graft survival. Also, when there's thicker, curlier hair on the scalp, usually there's less hair in total. So it's important to adjust your graft numbers so you're not just treating it like any other hair type. If you want to learn more about the unique challenges of Afro hair transplantation, make sure to check out my video dedicated to that topic. And remember that with any hair transplant, there's a limited donor supply. So we need to be careful not to over-harvest and not to use too much of the graft supply for any one area. So sometimes what happens is that people try to build up that hairline so much and so low that you run out of grafts to deliver an adequate supply to the rest of the frontal scalp, the mid-scalp, and crown, and then the results can look less natural. So it's important to think about coverage and density. And before any hair transplant, it's important for the hair to be as stable as it can be. And usually people arrive at hair stability with the use of medical therapy, primarily finasteride and minoxidil. So please don't just go to Turkey. As I often say in my videos, it's not about choosing a country. It's about choosing a specific surgeon who's going to take the time and care to do your surgery properly and to follow you over time and give you the best possible results for long-term success, not just for a few years. Jaylen, thanks so much for being so open about your hair loss. It's not easy being vulnerable, especially when you have such a huge crowd watching your every step. To a smaller degree, I know how you feel, and I'm happy to advise one way or the other. So if you're interested in chatting more about your options and getting a non-biased perspective on whether surgery might work for you or not, I'm easy to find, and we look forward to hearing from you if there's anything we can do to help you along your journey. So what do you think about Jaylen Brown's hair transformation? Do you think that more athletes should use hair fibers? Should they go on medical therapy to prevent further loss and improve the overall fullness of their hair? Should they be getting hair transplants, or should they just shave it all off? Let me know in the comments below. Thanks for watching, and don't forget to subscribe to my channel.